But when we're inundated by the media and talking heads propagating extreme, salacious headlines, and there's a ticker on the screen with the death toll rising like it's the freaking stock market ticker, this can create a situation where it's significantly more challenging to accept factual information that contradicts that. For example, in Italy, the country that was really hit hardest prior to the United States embarking on our own lockdown and quarantine, in Italy, the scientific advisor to Italy's Minister of Health, who is kind of like, we could say the counterpart, their Fauci in Italy. The scientific advisor to Italy's Minister of Health has stated publicly that, quote, the way in which we code deaths in our country is very generous, in the sense that all the people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus. On reevaluation by the National Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died that have been infected with the coronavirus had at least one premorbidity. Many times they had 2 or 3, end quote. Another Italian government official encapsulated the data by saying, quote, I want you to remember that these people died with the coronavirus and not from the coronavirus, end quote. We're looking at issues that are widely overlooked. For 88% of these folks, where coronavirus was listed as the cause of death on their death certificate, 88% of these folks having cancer, diabetes, heart disease, that were deemed by these professionals to be the real cause of death. They just happen to have the virus. And so when you take that piece of data into account, it slashes the number of deaths by thousands. Suddenly it becomes less scary. And suddenly it should shift our conversation to how do we help 88% of these folks who are so susceptible to dying because of chronic illnesses that are largely driven by things that are controllable. We can help, but we can't help if we're not focused on the real issue here. The craziest thing about this is that the same thing is happening in the US with inaccurate reporting and not acknowledging the underlying cause that we actually need to do something about. In the US, the vast majority of deaths, 94% at this point reported, occurred in patients with underlying conditions. Most commonly reported were diabetes, chronic lung disease, and heart disease. A new study published in the Journal of the American Medical Association analyzed the data of hospitalized COVID-19 patients in New York City and uncovered that the most common comorbidities were hypertension, obesity, and diabetes, at least 94% of the time. We're talking 94 to 98% of the time. But what we tend to do is, because of our cognitive biases, most people that are so engulfed in the fact that these numbers are so bad and so high, they'll ignore the fact that we have all of these other comorbidities, and they say, well, Shawn, totally healthy people are dying too. Not really. Not really. That's the exception and not the rule. And who are you to say that they're healthy in the first place? None of us are immune from the basic laws of the body. None of you are immune, myself included, from the basic laws of human health. So even though I might not have a diagnosed chronic illness, if I'm under extreme stress, if I'm sleep deprived at this time, if I am deprived nutritionally, if I have nutrient deficiencies, I am subjecting myself to a higher incidence of a virus killing me. This happens every year, every day, every single day, all day, forever, as long as humans have existed. But more so today. Because we're radically unhealthy compared to our ancestors. And so that's what I want us to understand. Tens of thousands of people die from the flu every year in the United States. And not to say, I'm not comparing COVID-19 to the flu. I'm not doing that. I'm just saying, why were we not upset? We should have been upset that, again, upwards of 98 to 99% of the people who died from the flu had diabetes, were obese, had heart disease. Why are we not helping people? The same government bodies that are telling you to hide out in your home are allowing people to eat all of this shit, to eat all of this dangerous, deadly, processed food. Matter of fact, they're promoting it. Matter of fact, they're receiving government subsidies to give you more of it. The craziest thing for me right now is seeing the people who, under other circumstances, like, I don't trust politicians. I don't trust the media. It's fake news. And all of a sudden, the news is real. Politicians, what they say is gospel now. Like that, because they're afraid. And those cognitive biases, something cut right through. Because they're like, I don't trust my politicians. Well, my politician said, we've got to take back control of our minds. Who has control of your mind? You know that little game when you're a kid, like, who's got your nose? Who's got your mind? Who's got your mind? Again, not to say we don't have an issue here, but we're going to expand on this even more so you know what the real issue is.